Well, I can't tell you what an honor it is to be sitting here today with Dr. Nizar Tanir from MD Anderson Cancer Center. Dr. Tanir runs the kidney cancer program at MD Anderson and has a wealth of clinical trials under his belt. Today we're actually going to be talking about non-clear cell kidney cancer. Dr. Tanir is going to elaborate on what that is and a very important study that he's led to address how he might actually treat that disease. Dr. Tanir, thanks so much for coming today.
Thank you for the opportunity, Monty. It's always a pleasure to be with you.
Likewise. I want to start with a very basic question. What is non-clear cell kidney cancer?
Yes. Well, non-clear cell renal cell cancer is actually a basket of several distinct renal cell cancer subtypes. As you well know, renal cell carcinoma is not one disease. It's a heterogeneous disease. And the most common type is clear cell. And that's where most of the trials have been conducted. Industry-led trials as well as investigator-initiated trials, because that's the most common, and that's what we have learned over the years from studying inherited syndromes, familial syndromes of renal cell carcinoma. And after the discovery of VHL tumor suppressor gene in the inherited VHL disease, that's when these drugs were developed to target the downstream effects of VHL mutation. So non-clear cell is still considered a poorly understood diverse group of renal cell carcinoma subtypes. If we look at 100 patients, for example, with renal cell cancer who have had nephrectomy, about 75% will have the most common type clear cell, and the 25% will have these other, that we refer to as non-clear cell. The most common subtype of non-clear cell is the papillary, comprising around 15% of all RCC cases. And then you have chromophobe, about 5%, and oncocytoma of 5%. Then when you look at patients who develop metastatic disease, whether they present with metastatic disease at initial diagnosis or they develop recurrence of their disease with metastasis after they had initially nephrectomy, the number of non-clear cell will be even less than the 25%, more like 15-20%. So this is a diverse group of poorly understood tumors where there hasn't been as much investment in research and clinical trials to understand the biology of these diseases and to come with effective therapies for these diverse tumors. So under there, as I said, will be the non-clear cell basket will have papillary, and that's two types, papillary type 1, papillary type 2, and there is a chromophobe. And then there is a group that even with expert GU pathologists, urologic pathologists looking at the specimen, even if you have a nephrectomy, there will be around 5% of these tumors that the pathologist cannot report other than saying unclassified, because of our still limitations with microscopy and immunohistochemical stains, where we're still limited by those and we still cannot define that subgroup really well. So we say it's unclassified. And then you have these even rarer subtypes, such as translocation, renal medullary carcinoma, mucin tubular and spindle cell carcinoma. These are, very, very rare tumors seen in 1% or less of renal cell cancer cases.